Hello everyone, my name is Gabriella Cavallo, and today I will be discussing what does prison do to a prisoner's health while in prison and for the rest of their lives. So likelihood of confinement and reasoning. In the United States, it is estimated that 5.1% of all persons will be confined in a state or federal prison throughout their lifetime. The likelihood of men going to prison are at a 9% chance, which is higher than a woman at 1.1% chance. There is definitely an inequality seen as to who is incarcerated, with 16.2% chance of confinement for African Americans in the United States, 9.4% chance of confinement for Hispanics in the United States, and 2.5% chance of confinement for white people in the United States. So there are many types of inequalities in prison, the first and most important being physical and mental health inequalities. Physical health inequalities include limited access to health care, transmission of chronic infectious disease, increases likelihood for chronic non-communicable diseases, lack of treatment for substance abuse disorder, and injury from fighting. Mental health inequalities include limited access to mental health care as well. Depression can arise, anxiety, PTSD, isolation, and post-incarceration syndrome. So as we can see in this picture right here, in-state prisons' prevalence of serious mental illness is 2 to 4 times higher than in the community. As seen in the dark purple shade, 14.5% of males, along with 31% of women, suffer from serious mental illnesses in jail, which is much larger than the 3.2% in males and 4.9% in females in the regular society. So an overview of the lifetime effects in prison. Due to lack of health care in prison facilities, there are many conditions that prisoners may develop. Lack of initial treatment and monitoring of diseases can lead to long-term suffering and mortality. Along with suffering and mortality, it can be difficult for former convicts to become employed due to their lack of employer-desired traits, due to loss of social skills while time incarcerated. As we can see, people with incarcerated family members are less likely to report good physical and mental health than those with no family history of incarceration, as portrayed in this photo right here. So first, physical health in prison and inequalities. So many prisoners lack the proper healthcare system that is required in order to keep prisoners healthy. Over time, there has been evidence that while incarcerated, prisoners have difficulties receiving prescription medications, receiving intervention for health concerns, and receiving healthcare appointments. So first, we will discuss infectious diseases. Infectious diseases are transmitted by many factors: improper sanitation, overcrowding, lack of treatment, lack of sexual disease transmission prevention factors, sharing of equipment, and syringes. So as seen in this photo, there are over 1 million people incarcerated in the United States in the adult population, and this can definitely lead to overcrowding, which will lead to these infectious diseases. HIV, as of 2021, 1.1% of people living with HIV are in correctional facilities. Hepatitis, as of 2016, has a 10.7% chance to be in correctional facilities than the 1% of general population. Tuberculosis, as of 2021, 2.4 persons diagnosed with tuberculosis have been in correctional facilities. So physical health in prison and inequalities. So as an overview, on this picture at the top, there is a survey that asked, in general, do you trust doctors or healthcare to make medically correct decisions? 49% answered yes, 51% answered no. And the second part, in general, do you trust doctors or healthcare providers in prisons to make medically correct judgments? 9% answered yes, and 91% answered no. So there's a large difference between the treatment of doctors in the general community and in the prison community. So there is definitely an increased likelihood for non-communicable diseases. High rates of non-communicable diseases exist in the prison population, and these include hypertension, diabetes, asthma, arthritis, as well as cancer. So lack of treatment for substance use disorder can lead to many issues. 47% of people who are in federal and state jails have met the criteria for substance abuse disorders. They offer severely inadequate treatment for those admitted with substance abuse disorder, and jails and prisons rely heavily on punishment rather than management of withdrawal to assure the health of the prisoner. AT is a drug or alcohol programming that is available in prisons to educate prisoners on drug use. In most states, there are not enough funds to cover MAT for half of prisoners admitted. In Washington, the state budget was $4.7 million for MAT purposes, but unfortunately, this only is half of the funding needed to support all prisoners. Lack of care and excess punishment to prisoners could lead them to re-enter the use of drugs, which can lead to health problems such as cardiovascular disease, infectious diseases, and mental health disorders. Lifetime physical health effects of prisoners. So there have been studies to show that people released from incarceration suffer major health disorders and are 13 times more likely to pass away soon post-release. As seen here, people with incarcerated immediate family members have reduced life expectancy as well. One immediate family member incarcerated allows for 2.6 fewer years of life expectancy, and 3+ immediate family members incarcerated allows for 4.6 fewer years of life expectancy. So as seen, the physical health of prisoners not only affects them, but their families as well. To continue, effects of infectious disease. HIV causes a weakened immune system, which can lead to deadly infections such as HIV. Prisons should offer more education on HIV and offer preventative measures to reduce the risk of HIV within prisons. Tuberculosis can lead to chronic damage of the lungs, which causes a weakened immune system and proneness to respiratory infections. Hepatitis can lead to liver damage as time passes, and this induces the risk of liver cancer. So as seen, the infectious diseases can lead to non-communicable diseases due to weakened immune system, leading to the chronic non-communicable disease. Hypertension, diabetes, asthma, and arthritis have long-term effects on the lives of prisoners during confinement and post-confinement. These chronic conditions may lead to further disease and overall a lower health-related quality of life. Post-confinement effects. Once released from prison, it may be very difficult for readaptation to the environment due to all the diseases that are possible to be gained from prison. Due to prison, it may be difficult to readapt into society, so it is extremely important to have support in doing so to avoid any form of recidivism. Unfortunately, it is very difficult for individuals with health issues along with criminal background to find a supportive employer, and lack of ability of finding a job can possibly lead to recidivism rates to increase due to resort to illegal activities to stabilize financial needs such as rent for an apartment. Now, to move on to mental health and prison inequalities, there are extremely high amounts of people with mental health disorders that remain in prisons and jails with lack of access to mental care help. Many prisoners lost all of their autonomy. This easily may lead to depression. Lack of autonomy in prison, along with lack of day-to-day change, can lead to anger and stress. Trauma from viewing violence can also lead to anger and stress, and it was reported in a 2003 study that incarcerated people in England resort to substance abuse in order to cope with boredom, of isolation, and lack of social interaction. Prisons should have access to mental health care. Most of the time, individuals who have been incarcerated are in prison due to actions induced by already existing mental health disorders. In prisons, some jails and psychotherapy is done by yelling through the cell doors, which may lead to more trauma. It is important for prisons and jails to provide mental care help in order to avoid further suffering and trauma from prisoners. Mental health care in prisons may assist in prosperity for individuals once released from prison. The long-term effects of mental health. The stress of the solitary confinement can lead to permanent changes in people's personalities and brains. Due to witnessing traumatic violence in prison, alienation, and etc., post-traumatic stress disorder can be developed after prison. Post-incarceration syndrome is a subtype of PTSD that arises from imprisonment. PIS can lead to difficulties in prisoners attempting to re-enter society. Due to untreated mental illnesses, recidivism rates are likely to remain high. Mental health disorders lead to improper decisions being made, leading to re-incarceration. Now, moving on, we will discuss the ethical content and moral theories in inequalities with physical and mental health in prisons and jails. A moral theory is an explanation of why an action is right or wrong, or why a person or a person's character is good or bad. Utilitarianism, virtue ethics, Kantian ethics, and principalism apply in discussion of the health of prisoners while in prison and post-release. So the photo in the background is kind of portraying the good versus the bad and how this can be balanced using moral theories in different scenarios. First, utilitarianism. The view that right actions are those that result in the most beneficial balance of good over bad consequences for everyone involved. Prison is extremely difficult on the health of individuals in prison, and the lack of health care does not increase the welfare of prisoners. Utilitarianism focuses on the benefit of the greatest amount of people and first, the input of a more structured and accessible healthcare system in prisons would allow for much greater levels of benefit from prisoners. Better access to physical health care along with mental health care will allow for overall greater satisfaction. Greater satisfaction while in prison can lead to a higher chance of success post-release. Virtue ethics. According to virtue ethics, character is the key to a moral life, for it is from a virtuous character that moral conduct and values naturally arise. Regarding healthcare in prison, it is extremely important for the incarcerated to receive the proper treatment. Healthcare providers, regardless of the scenario, are still called to have compassion and integrity for their patients. Therefore, it is important that this treatment remains for those incarcerated. Ethical treatment on prisoners in regards to healthcare can lead to better physical and mental health in prison and for the rest of their lives. So Kantian ethics. Kantian ethics states that core morality exists of the following: irrational of universally accepted moral rule and doing solely out of a sense of duty. According to Kant, to respect the dignity of all humans. Duty in prison relates to the prisoners themselves along with their administrators. So first, to discuss the administrators, as seen, prisoners are not treated with dignity. Sparse access to physical health care and yelling as a form of psychotherapy proves as to how prisoners are not receiving fair treatment. The prison administrators have a duty that is to be accepted universally. Although the administrators may believe that their prisoners deserve harsh treatment due to their actions, they must treat prisoners based on duty rather than personal feelings. And I included the universe in the background just to kind of portray the way that all actions should be universally accepted. In the case of prisoners, they must serve their sentence out of a sense of duty. It is said that an action is praiseworthy if it is acted out with a sense of duty. By serving time for wrongdoing, incarcerated individuals are acting on a sense of duty in order to pay back for their wrongdoings. The last moral theory we will discuss is principalism. Principalism calls for respect of autonomy, promoting of happiness, which is beneficence, refraining from harming others, which is non-maleficence, and the distributions of benefits and burdens fairly, which is justice. In regards to autonomy, prison, to an extent, removes autonomy for individuals. But the right to healthcare can never be removed. It is important for prisoners to have the ability to make choices in regard to their health. In regards to beneficence, healthcare providers in prisons have the optimal responsibility to act in a way that will allow for the best health of prisoners. In regards to non-maleficence, it is the healthcare workers' responsibility to assure that their patients are receiving the best healthcare with minimal risks. It is important for healthcare providers to assess possible risks in order to avoid them. Unfortunately, there have been times where some patients have not been disclosed of the full harm of their condition until all the options are laid out in order to avoid the patient from doing harm to themselves out of fear. Justice refers to people getting what is fair or what is their due. In terms of retributive justice, it is said that justice is served only when people act on their wrongdoings. In the case of incarcerated, they are serving time for their past doings, which will allow for justice. In the case of distributive justice, this concerns the fairness of the prisoners who are serving time for their past doings. It is important that all individuals in prisons have access to healthcare services and preventative measures. It is definitely important that prisoners have safe and sanitary conditions in order to avoid illnesses. The welfare of prisoners is extremely important, and due to this, it is crucial that education services are instilled in jails and prisons. To wrap up this presentation, I will be doing a test yourself questions based on the slides. The first question is, due to lack of health care, what is one possible outcome for prisoners upon release? A, easy access to a job, B, financial stability, C, lack of employer desired qualities, and D, equal treatment in society. The answer is C, lack of employer desired qualities. Due to all of the physical and mental health inequalities while in prison, it may be very difficult for these prisoners to leave prison with confidence and the health ability to have desired qualities. Question 2. According to Kantian ethics, why are prisoners called to serve their sentence? A, as a sense of duty for all their past wrongdoings. In most cases, it is so the prisoners desire to do so, to have more accessible self-care, and last, due to guilt. The answer is A, as a sense of duty for all of their past wrongdoings. And the last bonus question is, what was one form of harsh psychotherapy stated in this presentation? A, easy conversation with easy accessible healthcare providers. B, harsh yelling through the open cells. C, allowing prisoners to get exercise. And D, forcing prisoners to get rest. The answer is B, harsh yelling through the open cells, which has been proven to not be effective and has just proven to increase recidivism rates. That is it for my presentation. I really hope you all enjoyed it. This is my works cited, and that's all I have for you. Thank you so much, and have a great day, everyone.